Hi, my name is Marika Kopecki, and I work in the dental department at the Community Health Center. I am a dental hygienist, and I also do administrative work, working with the dental director and assisting her when she needs it. So today I'm going to talk about a few different things. I'm going to talk about Medicaid benefits and slide benefits. I'm also going to talk about what to expect from your visits when you come. And I'm going to talk about how to care for your teeth at home and your diet, taking care of young children, and what to expect when you get fillings or extractions, as well as how to use the interpreter service. So when you have dental Medicaid benefits, you have $510 per year to use towards most any treatment that you need. And that coverage, when you first come to the United States, the coverage will last for 8 months. After that first 8 months is up, you will then need to reapply for your Medicaid benefits. Oftentimes, if you need a lot of treatment, you will have the $510 and you'll use all of it up before you finish all of the treatment that you need. When that is the case, we encourage people to apply for the sliding scale fee, and this is based on income, and it's something that you can use after you've maxed out your Medicaid for the year. We do encourage you to use up all of your Medicaid benefits if you have treatment that needs to be completed. We also encourage you to take advantage of the sliding scale if you need additional treatment. It's there to help you, and it's there to help you pay for your treatment. So we definitely recommend that you use it when you need it. If you ever have any questions about your financial status or paying for treatment, patient services is always very helpful. They can give you an idea of other services that you may qualify for as far as paying for your treatment, and they're always here and available for you whenever you need them. We also have phone interpreters available to you whenever you need them, so if you call on the telephone and you need to use an interpreter, we can get one. If you come in person and you need to use an interpreter, we can call one. But just to make sure that you understand that you can always ask for an interpreter, and they are always there to help you. They are on the phone, so they're not in person, but there will always be an interpreter there for you if you need it. So when you first come to the dental center, your initial visit will be with the doctor, and you will have an exam, and we'll take a variety of x-rays. And the first visit will just be a time for you to come, take the x-rays, see the doctor, see if you've had any dental treatment done in the past, and also evaluate if you need any treatment for the future. After you've had your initial exam and x-rays, you will then be scheduled for a cleaning. Everyone needs to have cleanings regularly, so you will always need to have a cleaning. You'll also be able to set up any appointments for fillings that you may need, or extractions, or any other issues that you may be having. We can set those up for you at that point. When you come for your cleaning appointment, usually the first visit is the hardest visit. A lot of times people have never had a cleaning before, so it can sometimes be a little uncomfortable. But I assure you, after you start coming regularly, it really does get easier. It can sometimes take a couple times to complete the initial cleaning process. And then once we're finished with the initial cleaning process, we then decide how often we want you to come. So sometimes you come every 3 months, sometimes every 4 months, sometimes every 6 months. It really just depends on what you need. So initially, when you come in for fillings or cavities, this is when the tooth is decayed and it can be fixed. So we will take out the decay in the tooth and put a tooth-colored filling in it. So it will look like the rest of your tooth, and it will blend in, and no one will notice that the cavity was there. You will be numb for the procedure, and so you won't feel anything, so it'll be comfortable. The only uncomfortable part of that is the initial getting numb. But then after that, you won't feel any of it. Sometimes people need to have teeth extracted, and this is when a tooth has too much decay in it, or there are other problems with it, like it's chipped or it's cracked or something's wrong with it, and there's no way that we can fix it. And the only way that we can take care of the problem in your mouth or the infection that's in your mouth is to take the tooth out. So this procedure can be done here as well. You would get numb for this procedure. Sometimes people are a little bit sore afterwards. It usually heals pretty quickly, but the only way to get the infection out of your mouth is to take the tooth out of your mouth. So a big part of taking care of your teeth and making sure that everything's healthy in your mouth is making sure that you have a good diet. Oftentimes Foods and drinks that are really high in sugar can cause cavities, so things like soda, candy, just lots of sweet foods in general, juice, all of those things put you at a higher risk for getting cavities. It's best to really try to avoid eating foods often that have sugar in them. It's okay to have it every once in a while for a treat, but if you're going to have juice or soda, it's best to try to just eat it when you're having a meal instead of snacking on it or drinking it throughout the day. Water is best to drink throughout the day. So if you're somebody who drinks soda or juice often throughout the day, it's best to try to limit it and not sip on it throughout the day. What we're really worried about is frequency. So every time you take a sip of juice or soda, it makes it so there's more sugar in your mouth. So if you just drink it at one time and then be done with it and then drink water afterwards, that's best for your teeth. Eating candy also can cause cavities. Oftentimes candy is sticky or people will suck on it for long periods of time. It's best to try to limit the amount of candy that you are eating and just limit it to when you want to have a special treat. If your child is still getting formula or breastfeeding, both of those also have sugar in them. So you want to make sure that if they are nursing or getting formula at night, in the middle of the night when they're waking up, you really want to make sure that you're taking good care of their teeth. It's not to say that they shouldn't be getting formula or nursing at night, but if they are still doing that, just making sure that you're diligent about their brushing and their flossing. Formula and breast milk contain a lot of sugar, and oftentimes babies like to nurse or get a bottle to go to sleep. And when that happens, the milk oftentimes will just sit in their mouth. And when that sugar just sits in their mouth, it increases their chances of getting cavities. Even when kids just first get their teeth in and there's a very little bit of the tooth coming in, it's still important to start brushing their teeth. It helps you develop good habits with your child. It helps your child develop good habits, gets them used to having their teeth brushed. You should treat their teeth just as the same as you treat yours as far as brushing and flossing. So if you have young children, it's best to start brushing your children's teeth as soon as they come in their mouth. You can use something like a wet washcloth or a paper towel. You can use a little finger brush. You can use a small toothbrush that's made just for young kids. You don't want to use a large adult toothbrush though. So you want to brush 2 times, twice a day, once in the morning, once in the evening. And then you want to start flossing their teeth once the teeth start touching. So it's usually not until they're a little bit older, like 1, maybe 2, you can start flossing the front teeth, maybe the back teeth, but usually the teeth aren't touching until they're at least a year, maybe 2. So you also should take care of your teeth by brushing them twice a day, once in the morning and then once in the evening before you go to sleep. Flossing is equally as important. You should floss once a day. Flossing is the only way to clean in between the teeth, and it is one of the first places where things like gingivitis or cavities start. Smoking cigarettes, chewing tobacco, or chewing betel nut or any type of substance that has betel nut in it poses a serious threat to your health. They can all cause oral cancer. Smoking cigarettes can cause lung cancer, and they could potentially cause other types of cancer. I know it's very difficult to quit all of these, but if you're interested in quitting, you can always talk to your doctor, or you can always try quitting on your own. One thing to keep in mind is that if you want to quit chewing betel nut, it's best not to try chewing tobacco or smoking cigarettes to use in replace of the betel nut, because you will then be addicted to the cigarettes or the chewing tobacco. There are substances that you can use, tobacco cessation products that you can use, like the patch or the gum, or some types of medication that can help you stop smoking cigarettes, but there is nothing like that for betel nut. So if it's something that you're having a hard time with, it is best to talk to your doctor about. All of these substances can also damage your teeth and your gums and the bone holding your teeth in your mouth, which is one of the big reasons why we also recommend trying to quit. So we're always here for you if you ever need anything, if you ever have any questions, or if you're ever in pain, or you just want to get set up and establish yourself as a patient. We would love to have you. So feel free to call us. You can also always email us, but we're always here for you whenever you need us.